So now for something completely different. Actually, I'll just tell a little funny story while these guys are sitting up. So many of you who know me know that I have identical twin boys who are musical geniuses, but are mathematically challenged. And I recently finished 5 years serving as chief of the Diabetes Prevention and Control Program for the state of California. And I told my boys, it was dinner table, my daughter, my boys, my wife, and I said, everyone, I just, today was my last day on that job, and I just want you to know, when I took the job, 1 in 9 California adults had diabetes. And 5 years later, 1 in 7 do. And my boys went, wow, Dad, you're awesome. So this is, it would have been 1 in 6, right, had I not taken the job. This is about trying to reverse that trajectory. And I'm going to present to you some elements of a social marketing campaign entitled The Bigger Picture. Many of you have received a red postcard, which is our flyer for the Bigger Picture campaign. And all of you should have received a pre and post evaluation, your stakeholders. So we would like to have your opinion about what you think about young people and diabetes prevention before and after viewing today's presentation. And with me today is Sarah Fine, if you could just raise your hand, who is the project director, awesome project director. So the Bigger Picture is a diabetes prevention campaign that harnesses youth voices, particularly in California, to try to paint the picture of the social and environmental conditions that are driving this epidemic to epidemic proportions and affecting younger and younger people. To start off the presentation, I'm going to invite to the podium Gabriel M. Cortez, who just informed me that he has a new collection of poems that just came out yesterday. Is that right? 2 days ago? If you go, we're on TV, so if you go to gabrielmcortez.org, is it?
Yes.
You'll be able to download his poetry collection. He's going to perform a poem he recently created in a workshop we did with You Speaks Poets around sugar-sweetened beverage consumption. You can hoop and holler, by the way, during poems.
Yeah. Please don't feel like you have to be quiet. And a quick correction, it's actually GabrielMCortez.com. We've got a lot of poems posted there. Cool. My grandpa flaunts a gold tooth when he smiles, like I dare you to take something from between my lips. His tooth shines from the light of the TV screen when my family watches Telemundo during dinner time. While I practice my Spanish, Grandpa unhinges the English from his mouth, at least for a little while. This is how we both practice being Panamanian American, through television and food. He tells us of our ancestors, how they raised maize and yucca from the earth, hands steeped in indigenous soil. How as warriors, we drank cacao and water bitter from the gourd, a medicine sacred to the gods. Between growing up in Colón, Panama, and a tour in the U.S. Army, Grandpa is a proud old soldier marching through a never-ending war. At 66, we are scared that another stroke will do what no war ever could and cut him to the ground. He drinks, like Aunt Maritza didn't lose both of her legs to diabetes last year. Like half of our neighborhood doesn't look like the emergency ward of a hospital, like he hasn't seen the pictures. How it is impossible to tell the difference between a roadside bomb victim and someone who just forgot to take their insulin. Grandpa keeps at least 2 12-packs of soda in the fridge at all times. Sunny Delight, Tampico, High C, a jug of Kool-Aid in the back. Dr. Pepper lines our refrigerator door like a vest of dynamite, an arsenal of ways for us to self-destruct. It is how you learn to drink, growing up in a country where soda is cheaper than clean water, where hunger is a canal carved deep into your belly, where the only options for work are the docks and the army, because your country is as occupied by Coca-Cola as it is by the U.S. military. When you must march to the call of whatever feeds family first, you drink whatever fits conveniently in your hands. I understand, Grandpa. But don't you know we are still at war with a country that wants us dead? How as children of Panama and America learned early to walk softly and carry a big stick, like U.S. assault rifle in one hand and Coca-Cola bottle in the other. Our country wasn't enough. They're colonizing our bodies, our taste buds. It isn't a coincidence that the military and beverage companies call us their target audience, our black and brown bodies marching to the center of their crosshairs. At home, a Coca-Cola commercial followed by a U.S. Army commercial flickers across my grandfather's tooth, and they both shine like the discharge of a gun. I learned to drink like Grandpa, like Colón Panama, like $14 billion spent on soft drink advertising last year. The threat of diabetes is as common in my family as hard work, obedience, discipline. It is as common as Coca-Cola in our refrigerator, and we drink until the glass is empty because we ain't never learned to pull maize from the soil, but we did learn to pull the tab of a Coke can. Don't it sound like the linchpin of a grenade? Both explode under pressure. Ain't we just time bombs then? We march until they cut the legs out from under us. Ain't we perfect soldiers? Thank you.
Thank you, Gabriel. So what is public health literacy? I really like Friedman's description, and this is what this project is all about. Improving the public health literacy of young people to become agents of change. She defines it as the degree to which individuals and groups can obtain, process, understand, evaluate, and act upon information needed to make public health decisions that benefit the community. The target populations are the public. The purpose is to improve the health of the public. The aims are to engage more stakeholders in public health efforts and address the determinants of health. And it is a multidimensional concept, including conceptual foundations, critical skills, and civic orientation. And this is what we try to impart in our workshops with young people around the epidemic of diabetes. Why is this a problem now? This chart shows you the distribution of types of diabetes by ethnic group in the United States. In yellow is type 1 diabetes, in purple is type 2 diabetes. If you look at non-Hispanic white children, 85% of diabetes cases are represented by type 1 juvenile onset diabetes. But if you look at nearly every other ethnic group, the majority of the diabetes cases, and in some cases the overwhelming majority of diabetes cases, are type 2, previously known as adult onset or grandpa's disease, happening in kids ages 10 to 19. A recent study, national study demonstrated that compared to 10 years ago, among kids ages 12 through 19, 10 years ago, 1 in 11 had pre-diabetes. Now, nearly 1 in 4 youth ages 12 to 19 have pre-diabetes in the United States. These kids have a 50% chance of developing frank diabetes within 5 years. It is important to note that in that 10-year period of time, body mass index did not change. So while obesity is a very strong predictor of type 2 diabetes, it cannot explain this explosion in the cases of type 2 diabetes among kids. What have we done to date with these wonderful poets and the organization with whom they are affiliated, known as Youth Speaks? We have directed 4 medically curated writing workshop series with 30 Youth Speaks poets like Gabriel. We have developed content that now includes 11 English poems that have been produced into public service announcements, varying in length from 30 seconds to about 5 minutes, and 2 Spanish video PSAs, and 5 more are in pre-production. We now have a Spanish and English website. We're active in social media. We have created an educator toolkit to be used by teachers in high schools because the center of this campaign is the school visit presentation, in which we present content like you just heard to kids in high school assemblies. Now, and then we've also created English and Spanish marketing materials and a bigger picture DVD that contains many of the PSAs. These high school assemblies, as I said earlier, are the centerpiece for this project. Let me just ask you, how many of you graduated from high school? Raise your hand, please. Wow, everybody. How many of you, oh, you did not, okay. How many of you went to a high school assembly? Remember going to a high school assembly? Most of you. How many of you remember one thing ever taught to you in a high school assembly? I've got one, I'll go one hand up. Okay. So the assemblies. We have presented now at 15 minority-serving public high schools. We present a 1-hour program moderated by a Youth Speaks Poet mentor and includes poet performances like one you just heard and video PSAs. Presenting to 500, at times more than 500, rowdy high school students in low-income high schools. The domains included in the assembly program are some basics about type 2 diabetes, statistics outlining the social and contextual determinants of this disease, because a lot of kids think about it as a genetic disease, it's in my family, and resources and examples for community and policy action. And then in some schools that took us up on the offer, there was also a supplementary 1-hour writing program where a subset of students will write responses, their own poems, in response to the assembly presentation. I want to give you a flavor for how we get these kids' attention, because you can imagine, you get 300 kids in high school getting into an auditorium like this to talk about health stuff. It's not exactly exciting. So this is a poem written by Jose Vadi. Jose, maybe raise your hand over there. And this is about feet. And as you know, diabetes can affect your feet. And this poem is called Soulmate. Oops. Let's go back here. There we go. One more, okay. Oh, yeah.
We used to make miracles together. From baby shoes to birthday dances to skateboard nights, we were as punctual as recess, swiftly crossing the punctured asphalt, stopping on a dime the minute the freeze bell rang. We were a hand in glove, a size 13 laced in. This foot that has tasted the grass of Humboldt between my toes and the beaches of Hawaii. You were a friend to lean on, and now I'll never be able to stand on my own 2 feet again.
So that really gets young people's attention. There's a lot of screaming and, yes, hands to Jose. So Sarah, the PSA was lagging behind the poem, so I'm not sure how the next one will go, but we'll try it. The video was slower than the words. Am I going to go to this one? Okay, we're going to try this one, and if not, we'll have to ask Jose to spontaneously perform it. This is also Jose Vadi's poem. This was actually the second poem created out of the campaign, and it really, it's about the food environment in his corner of Oakland.
We're standing on the corner between healthy and heart attack, not sure which way to cross. On one side, an organic grocery, the other, deep-fried death. Our bodies pull us away from the produce aisle into value meal heaven, ignoring the question of just what part of a chicken is a nugget anyway. Every bite a last meal telling us this is just temporary. But greener, more nutritional options are right across the street. Yet our bodies demand mechanically processed meat. And water costs more than milk, when broccoli costs more than beef. They want a pound of flesh for every 90 pounds of sugar we eat in a year. Our whole block is at this trough, thinking we're full, before meeting back on the corner, starving for the next meal. They turned our bodies into battlefields, turned our cookbooks into combo meals, and told us to drive through. My wallet says to supersize it. We can tell you 5 different paths to the deep fryers sizzling past midnight. Nobody dares to turn off their neon lights, but their cheap digestible cyanide turns my kiss into snake bites. Take an x-ray of my guts and you'll see the proof's in the pudding. When our diets make parachute pants out of our jeans, our ankles become cankles, our blood a stained sewer circulating in our bodies. Only gangrene amputees will be our legacy. Corporate-sponsored deadly delicacies. How much longer must we lose the battle before we start the war against diabetes here on the corner of healthy and heart attack, life or stroke? Because we don't want to end up on the corner pricking our thumbs with a lancet to measure our sugar levels every day before we finally decide which way to cross. How far do we have to slip before we end this edible misery and rewrite our recipe?
That was, again, Jose, who really is the heart and soul of this campaign. Even though he was one of the first poet, he keeps at it, tweeting, writing poetry, teaching others. It's great. Let me share with you, by way of wrapping up, our results to date. This has been a pretty small campaign focused on the San Francisco Bay Area. We are now expanding it to other parts of California, would like to go national. We've presented to over 25, when I say we, they have presented to over 2,500 high school students from 15 low-income public Bay Area schools. We've presented to over 700 health, education, and community stakeholders. With you, it'll now be 770. We've had more than 100,000 hits on our campaign website with absolutely no budget for advertising. This is what we learned from the presentations to high school students in those assemblies. Now remember, put yourself in the mindset of a high school student in an assembly. We gave out to a random sample of high school students clickers, those clicker responses that you've probably used in grand rounds or other presentations. We asked them questions before the presentation and after the presentation. Before the presentation, 70% agreed that type 2 diabetes is preventable. After the presentation, 92% believed it was preventable. And then here are the two big ones. Before the presentation, only 34% of high school students included environmental and social causes as influencing one's diabetes risk. After the presentation, it was 83%. That's the public health literacy part. With respect to a call to action and a willingness to engage, only 29% cared a lot about diabetes prevention before the presentation as compared to 59% of kids answering 5 on a 5-point Likert scale saying, I care a lot about preventing diabetes. When we ask people like you, stakeholders, who have seen these presentations, what they believe about young people, I want to point out 2 things. First, before seeing the poems, 67% believe that young people can serve as agents of social change. After seeing the videos, 99% believe that. And 96% reported that the strategies used in this project, that is youth-generated spoken word pieces, are relevant to their organization. Our next steps are to expand the Bay Area School Visit Program to be able to offer it to other schools, to scale the bigger picture model statewide to Richmond, which is a very hard-hit city in California, Stockton, another hard-hit, and the Inland Empire east of here. And then even nationally, insofar as Youth Speaks has offices throughout the United States. We also would like to extend to other chronic diseases because the social and environmental conditions that are causing diabetes are also causing hypertension, heart disease, etc. We want to enhance and evaluate our digital platform, which you can look at when you go to the website that's on the red flyer. And we want to increase the campaign's impact by developing and incorporating materials and content in other languages. How much time do I have? Okay, so if we have time later, we have a closing video, but I'll stop now. Thank you. Oh, and the videos are playing continuously in the lobby. Thank you.